So this is probably one of the most common and biggest fear patients have before having a colonoscopy. But to be honest, after doing this procedure hundreds of times, it isn't as painful or extremely unpleasant as people expect it to be. Most of the people in my experience and after talking to and doing this procedure a few hundreds of times is that they feel bloated, abdominal distension, a bit windy, and some people get cramps, but they should not be having pain with this procedure. And particularly if the scope goes around your bowel, understandably, because the natural tendency of the bowel is to get everything out, the tendency of the bowel is to cramp and feel a bit bloated. But if it's causing extreme pain, then there's something which is not right and the procedure should be stopped. Again, there are a lot of techniques and procedures which I apply to my patients. We call it water-guided colonoscopy and immersive water immersion colonoscopy. There are other things which we can try, which can help with the pain, and we give a good safe amount of optimum safe amount of sedation as well to help with abdominal pain, bloating, and with using gas and air mixture and sedation, most people are able to tolerate it very well. My advice probably would be don't let fear of pain stop you from having a colonoscopy. If you genuinely need it, we have several ways of making the procedure as comfortable and safe for you. Not necessarily. It's a very important concept to understand for all of us is that colonoscopy is usually and often performed because of unusual and unexpected symptoms. What I mean with that is that if you would have bleeding from the back passage, if you would have persistent change in bowel habits, if you would develop iron deficiency anemia after a certain age, or unexplained weight loss, then these conditions or these symptoms usually prompt your doctors to arrange and request an urgent colonoscopy for you. But symptoms aren't the only reason. Some people need a surveillance colonoscopy. For example, if they had a previous colonoscopy, which they found certain number of polyps or certain size of polyps, because the small number of these can develop into something more sinister. Hence, we need to check them every few years, which is a called surveillance colonoscopy. Some people would need that if they have been diagnosed with inflammatory bowel disease, and hence again, just to make sure that the lining of the bowel has not change into something more sinister, they need to have these repeated surveillance colonoscopy or colonoscopies after a few regular intervals so that the tissue samples can be taken. And in certain individuals, colonoscopy is required if either yourself or your family history is positive or present for colorectal cancer or other sinister pathologies. Hence, it's not all for symptoms. Sometimes it's for other reasons as well. Reassuringly or interestingly, in UK, we have got a bowel cancer screening program. In those patients after certain age, you have to you have been asked to drop a stool sample to check for fit test, which is a small amount of usually unnoticeable blood into the stool, which we have found to be associated with something more sinister in small number of people. Hence, after certain age, you drop this sample, and if that comes out to be positive, you have been asked to do a colonoscopy to rule out something more sinister. So my message usually to all my colleagues and patients is that the important thing is to choosing the right test for the right person at the right time. Again, an excellent myth to clarify. Bowel problems don't have a age cutoff, and neither should our colonoscopy be. Although I agree, and that is what the data suggests as well, and the evidence all over the world suggests that likelihood of bowel cancer increases with age, but younger persons can develop conditions such as inflammatory bowel disease, polyps, and less commonly bowel cancer as well. And in my last few years of experience, I'm seeing more and more of new symptoms being developed at an earlier age, and new diagnosis of sinister as well as sinister causes, as well as inflammatory bowel disease being made at an earlier age as well. So we don't decide whether somebody needs a colonoscopy simply from their age. We obviously, understandably, look at their symptoms, time of onset, persistence of the symptoms, their alarming symptoms, their family history, and their overall risk, and then decide who needs colonoscopy and who doesn't. Being young can be reassuring, but persistent or concerning symptoms should still be properly assessed and referred for appropriate investigations. So after doing hundreds of these procedures in last few years, colonoscopy is generally considered a very safe procedure. But to be honest and realistic as well, like many medical procedure, it isn't completely risk-free. Most commonly, the people will get abdominal pain, bloated, and feeling of discomfort, which usually resolved few hours after the procedure. When I do the consenting in the room with before the procedure, I discuss these things on a daily basis. That most majority of the people will not going to feel anything. They will come out of the room, pack their bags, go home. Will never going to even remember they had a procedure or any side effects with that. But small number of people can develop untoward incident or complication, and the most worrisome for the patient as well as the healthcare professionals and doctors are the perforation, which basically means making a small hole in the bowel. Now, fortunately, this is very uncommon. And when it happens, it's usually it's self-resolving. It's very rare, especially in a straightforward diagnostic colonoscopy, which majority of colonoscopies are. The risks are slightly higher when we perform the treatment during colonoscopy, for example, taking out or removing a large polyp. Similarly, small number of people can develop bleeding. This again is the chances of this is having bleeding is more when you are taking a large polyp out, but otherwise these chances of these side effects or complications are very low. The important thing is that when a doctor or healthcare professional requests a colonoscopy, usually the benefits of having a colonoscopy outweighs these small number of risks. If you have got any alarming symptoms which could suggest something more sinister underlying, then these risks are very minimal as compared to the procedure benefits. And hence, the important thing is that we recommend colonoscopy when the expected benefits outweighs those risks. No, finding polyp does not mean that you have a bowel cancer, but polyps are small growth which normally arises from the lining of your bowel, and they are actually quite commonly found during colonoscopy. The reassuring thing is that most of them are not cancer, but however, some type of polyps can generally develop precancerous changing over a long period of time or a number of years. That is why when it's safe and appropriate, we remove them during the colonoscopy and send them to the laboratory for analysis under microscope. A small number of polyps can have precancerous changes, and that is why usually all of those polyps needs to be taken out when they have been found during the colonoscopy, unless it's not appropriate or safe as mentioned above. So finding and removing a polyp isn't necessarily a bad news. It can actually be cancer prevention in the future or in long-term basis.